Ethics part of it, we are really going to leave it to the end, because meanwhile, I want to throw the floor open at this stage to questions that you all may have. I mean, after all, we have really the best of experts in the field. If that's something that, we can have the questions, Aarti is going to help us get there. But even as I get the questions, may I ask and put the question to you straight away. Some of these myths about pregnancy, motherhood, breastfeeding, yes. But what are the commonest things, doctor? I mean, one thing that, I'm a mother myself, and I remember that when I was pregnant, I used to get told that don't eat papaya, don't eat certain things, or even, in terms of don't cross your legs and sit, because there'll be a cord around it. I mean, what are the, I want each one of you to very quickly tell me a couple of things that you come across and what you want to clear.
I think about eating papaya, till today we get queries. If I tell my patient to eat papaya, and the whole family is going to throw stones at me. Because it's been proved in books, it's the raw papaya which is an abortive scent. Somehow it's been carried over for ages that the papaya word itself should not be uttered by a pregnant woman. That much fear they have in their mind. It's the raw papaya which has been proved beyond doubt that it can cause abortion, but not the ripe papaya. In fact, it has got a lot of best nutrients. At times, patient herself quietly calls up, or she sends off her husband and family members outside, and she asks, "Doctor, I feel like having papaya." 1 or 2 instances are there where I have permitted her to have ripe papaya. Okay.
So it's not a forbidden fruit. I think we need to clear that bit about the poor papaya.
First 3 months, yes, definitely it can cause abortion if it's a raw papaya.
Right. Yeah. What about you, Dr. Bharti? What is the commonest, let's say about the posture or the diet that you want to clear, about your patients? What they ask you? Is sitting with a cross-legged thing, does it really hurt the pregnant woman in any case?
If she's comfortable, yes.
Otherwise, as in there's no harm, you're saying?
No harm in any posture, but only while sleeping, yes, it is good to lie on the left side.
While sleeping?
Yeah, while sleeping to the left, so that it helps to remove all the blood, the major vessels, so that there'll be good flow of flush of blood.
That is in terms of circulation.
Yes, in form of circulation to the womb, and also it can prevent one we call as hypotension syndrome.
Okay,
so that there will be no problem. So it's better to lie on the left side and in a semi-reclining position. That would be good, just to prevent the heartburn.
What about you, Dr. Gayatri? Do you want to, is there something very, very weird that patients have asked you that you remember at this stage and that comes to mind?
Yeah, many of them ask about rolling over in bed. They feel they've been instructed that every time they have to roll over, they have to sit up, turn sides, and then lie down again. I think it's such a punishment to the pregnant mother.
Very commonly I come across this.
And I tell them, if twisting a cord around the neck was so easy, I would ask the patient to go the other side and untwist the cord, isn't it?
I think Anindita is going to be spared this part of it, though of course you're most welcome to share if you went through, you're a mother yourself. What is the weirdest thing that you got told?
Again, everything for me seems to have happened post childbirth, but a lot of things about what to feed the child were, I think there are a lot of, especially about giving the child water in the first few months, because as far as I know, we're not supposed to, but there was a lot of pressure that we should be giving water.
So should we or should not? Can the baby be given water in the first few months? I think it's a good opportunity to clear the doubt once and for all. A new baby.
Breastfed mothers do not require to be given. Yeah.
Okay, and what about malish? Who wants to really say whether the malish for the baby is good and the mother?
Yeah. I don't know whether it's how harsh the malish is or how fine it is. It depends on that. And second thing, many of the high-end hospitals probably are recommending malish, and in fact in-house they are getting malish before they go home. So probably the trend is going to pick up that light massage or oil massage or whatever it is definitely good for the body, which has gone through so much of physiological changes and which has gone through the stress and strain.
Right.
Usually, yeah, I tell that there are Chinese people who most believe in this because they believe in reflexopathy. Because the massages what they give.
Reflexopathy, did you say?
Yes.
Okay.
When they massage, they tell that they give superficial massage, give a relaxation. But there are some spots which can trigger the uterine contractions, especially in the leg. That is, they climb and they have got evidence for it.
Okay.
Okay. In that, they can precipitate preterm labor.
Well, I think in the age of, pampering and privileged motherhood that we live, a spa sort of starts pretty early in life. Aarti, can we have some of those questions? Maybe in the interest of time, because we are running behind schedule, what we are going to do is to bunch a few similar questions and pose them to the doctors here and the experts. Sure, doctor. Yeah, yoga. That's a very, very crucial question.
Yoga in pregnancy is fast picking up, and there are a lot of asanas which are particularly meant for expectant mothers, which will also probably help her in relaxing her pelvic floor muscles and help her in go through the normal process of labor.
Right, so I think prudent doing of yoga is sure to help, and does it hold good, let's say, for other exercises as well? I mean, there are some of these high energy exercises, then there are Lamaze classes. I mean, there's a surplus of things that a mother-to-be can do. So how is she to make the right choice about what's a good thing to do and what's not to do? I mean, in terms of exercises.
It depends on her own lifestyle. If it is a person who does a lot of physical activity, then she can go in for more relaxing exercises like yoga and Lamaze.
Walking, jogging?
I am a very strong propounder of brisk walking, at least 30 minutes every day for every pregnant woman. So any form of exercise, be it yoga, be it Lamaze, be it brisk walking, I even allow them on the treadmill at the rate of about 5 kilometers per hour. I do not recommend jumping exercises only because it increases the risk of tripping and falling and injuring themselves. But otherwise, any form of exercise, as far as they're comfortable with it, and anything that is going to improve their basic stamina to go through labor is fine with me.
Well, we won't forget the point that you made earlier, which is that if you want a normal and natural childbirth, you've got to work for it. We have the first set of questions, and I'm actually going to kind of do a rapid fire thing for all of you because, the questions are many and we would like to save time too. Applying kajal to newborn baby, is that okay?
I think it induces infection. Preferably it is avoided. It's better.
All right. Dr. Bharti, giving bath at night, is that good or would you still stay with daytime? In the villages, some of us have found that they give bath to a baby at night times.
I feel that it would be better to give that during the daytime, because why it is so? Because usually they have to be very careful when giving the showers. Sometimes the water can get aspirated. That could be, but they will be careful, I know that. So there will be immediate medical support. That could be one of the probable reason. And that allergy, cold bath, night, I do not really know. That may be a provocative factor for rhinitis for the children.
All right, okay. That's really an expert's view on that. To you, Dr. Gayatri, there's this question coming from one of our audience there. They say that in the recent days, we hear a lot about increasing infertility. What are the reasons for this? And what are the solutions?
Right from not having time to being very tired after work, late marriages, late marriages, yes, and we are living in a jet age, so people don't have the time and patience to wait. In a normal couple, it can take up to 1 year to get pregnant. The latest was, I've had a patient come 3 days back saying, we are worried, I've been married for 2 years. I said, okay, so when have you started trying? The last 2 weeks. I said, please go back home. I think that is the main reason for infertility. And no doubt we are picking up more complications. We have many more solutions for infertility than what we had previously. I think 20 years back, many patients didn't even know why they were infertile. At least I think now the percentage of people having unexplained infertility is very less. So we have answers, and it depends, the treatment would depend on what the cause is.
I would like the mic to stay with you for just a moment more before I pass it on to the other doctors, because it's again another set of technical questions. Somebody who would say, can you quickly explain low-lying placenta and how complicated is it and the precautions to take?
First of all, there are no precautions. Placenta, the place where the embryo comes and implants into the uterus is where the placenta develops. So it is usually, in most patients, it would embed in the upper part of the uterus. But sometimes the implantation can happen at the lower part, which is when we call it placenta previa. And the ideal time for looking at it, I see patients getting reported as previa even at say 12 weeks. That's not the right time. 18 weeks would give us a good idea at the anomaly scan whether it's lying on the lower side or upper. And depending on where the bulk of the placenta implants, as the baby grows, it could move up. So if the bulk is on the upper part and it is growing up, then that is what we call migration of placenta. It's not that the placenta is moving, but in effect it is moving because the growth of the uterus is taking it away. If it is present in the lower portion, if it is blocking the exit of the uterus, then obviously the patient can't deliver normally. That is what we would call a central placenta previa. We have 4 different types. The first and the second type would be just within say about 3 to 4 centimeters of the inner opening of the uterus or the cervix. That would still be able to deliver normally. With the third and the fourth, where the fourth is the part what we call central placenta previa, and the third is again similar to that, which would probably open up. Now, these patients have a tendency to bleed anytime after 32 weeks, sometimes even earlier, but usually after 32 weeks. So we reassess at 32 weeks if they are likely to, if they still have a placenta previa, we warn them that they may have sudden bleeding, painless bleeding, and at times need to be delivered prematurely.
Right. There you have it, straight from the doctor herself rather than Dr. Google. This question for you, Dr. Jyotsna, how easy or difficult is it to have a normal delivery for women with anterior fibroid?
Okay. Fibroid is a very common gynecological problem. It affects as many as 50% of all the women population. But again, just the word fibroid, you don't have to get scared because we do not know the size of the fibroid. If it's half a centimeter, 1 centimeter fibroid, compared to a 10 centimeter fibroid, there is a lot of a difference. And the anterior fibroid, if it's say 3, 4, 5 centimeters picked up during pregnancy, nothing can be done. If it's picked up even before pregnancy, we do not usually recommend any treatment. But if the fibroid is 8, 10 centimeters big and couple are planning for pregnancy, that is when it will require surgery. And if it's an anterior fibroid which has been picked up during pregnancy, I do not recommend any further extra care, except that if she has a pain, she has to report to her doctor, because certain changes can happen in a fibroid exclusively during pregnancy, some degenerative changes. For that reason, she has to contact her doctor immediately when she experiences abdominal pain. Otherwise, there should not be a problem, except if such a patient lands up in C-section and the fibroid is lying at the area where we are going to give an incision, then it can pose little problem of extra bleeding or something like that. Otherwise, it's not a major health hazard.
Actually, if the head, anterior means the front wall of the fibroid, so it could be anywhere. Now, if the fibroid is below the level of the head, then the head may not be able to negotiate and come down. In those instances, I guess we would need to do a cesarean, but if the fibroid is above, she can definitely go and deliver normally.
All right.
Dr. Bhatt, times it gets stretched out, so don't get scared.
Okay, reassuring. Now, please, in fact, I wanted to ask you this. These questions are addressed to you. For working women, what is the minimum number of months or that you suggest that the baby would be needing? I'm imagining that the person who asked this question is looking at it from an ML, maternity leave point of view.
Okay.
So, you want to take that question?
Yeah, it would be roughly around about 6 months rest, so that she can completely feed the baby. If she has the luxury, she can have it.
If you have the luxury of 3 months extra ML, then I think Dr.
Yeah.
Bharti would recommend 6 months minimum.
Minimum, yes. Because she will be enjoying the motherhood and the family, and she will give, really, she will dedicate herself to the family and for the baby, you know.
Right.
And moreover, breastfeeding is very much important here. Dear friends, I tell you that it has got many advantages. So please don't keep your milk in the fridge and feed the baby.
Good. Would you
Okay.
like to stress more? In fact, it's a very
Yes.
important point that you brought in. The first milk.
Yes,
Yes.
yes. Sometimes they call the first milk is a bad milk, not to feed the baby, throw the baby. This is one of the myth, but please never do. Okay? They call it a witch milk. No, it is not good. Please throw. That is one of the myth. Please never do that. It is the one which has got nourishing, which is highly good for the baby. It acts as a laxative for the baby too. Okay? And please relax and enjoy.
Sorry, just one more quick question. It says that the vaccinations and the importance. I mean, these days every other day you have a new vaccine,
Yeah.
and you don't know what to go for and what to leave out. So,
Yes.
is there are there any tips to?
Yeah,
which are
yeah.
the
I do
important
tell you,
ones?
yes, we have to keep abreast of the newer advances, you know. So the pediatrician is the best guide to guide you. And moreover, please, I pass on a message to you. Those who are not vaccinated against HPV vaccine, this is the right time. Soon after delivery, please take 3 quick shots. Means one, and one after 1 month, and one after 6 months, so that it will cover you against the cervical cancer.
Right, but how many months is good for breastfeeding a baby? Till how long?
2 years? 2 years?
Even
3
after the
years?
baby gets its teeth, I have
Yes,
seen mothers
yes.
really cope with the situation.
Yes. Please instruct your baby. It can.
All right. Thank you so much, Dr. Bharti. A quick question now for you, Dr. Gayatri. In the sense, this person has been saying she's been undergoing a lot of back pain during pregnancy. Are there ways where we can effectively overcome this? What would be the treatment?
Backache is known in pregnancy, particularly because of the stance the mother adopts. The weight in the front portion is increasing with the baby growing. So there are natural changes happening in the spine which have to accommodate the center of gravity. So the mother tends to stand with her tummy pushed forward and arched back, and that is why the back hurts. Now, if you exercise, you make sure that the back spinal muscles are well exercised, the pain should come down. There are simple analgesics you can take on a very bad day, but not wear heels. These are some of the things that you can do. But ultimately it boils down back to exercise.
There is an exercise related question. In fact, that seems to be the favorite topic too. Post delivery, after how long can the mother start or resume exercise, and is it different for normal and different for C-sections?
Normal deliveries, I tell them to start exercising from the very next day, at least the Kegels exercises and the abdominal crunches. Cesareans, in a transverse scar, it would hurt them, so I would say 6 weeks. In a vertical scar, which is very rare these days, but sometimes we do, 3 months. But for the abdominal exercises. But the walking, the Kegels can start soon after birth.
Yeah, in the days when you're exposed to Shilpa Shetty DVDs and you know the age of the yummy mummies. So I mean, do you also get a lot more mothers who are aware of exercises and who want to get started as soon as they can? You want to add to
I
that?
do recommend to do exercises because there is one condition called DVT, means there will be clotting in the legs. Okay, that it causes really a dreadful condition if it is spread to the lungs, called pulmonary embolism. Please take a message here. Please don't lie for long hours. Please drink sufficient water and please exercise your legs and walk. If you find pain, please add supportive to your legs.
Before I pass the mic on to Dr. Jyotsna for the last question of this panel discussion, you're somebody, Dr. Bharti, who has worked in, I think, Maldives and Singapore and UK and also Brunei, which for me sounded very interesting. I mean, is there something very drastically different from the way, mothers approach motherhood? I mean, women approach motherhood or in the things that they come away with? What's the difference?
Yes. The difference starts from the family and from the public and from the government, which we lack. Okay, from the family, they get good support. They really cherish, with all gifts. And even from the hospital, when they move from the hospital, really they get lots of gifts, mementos, everything. And from the government, they get 6 months leave.
Well, that should give a lot of Tripti and Shanti to Aarti, because Cherish, I think that's the one which she'd been telling me when she invited me to anchor this thing, that I want every woman to be cherished for her own sake. It's not just what she carries in her womb, which is of course very precious and that's to be cherished. But so very quickly, do you want to take this opportunity to tell the mothers or the families what not to do? What is the thing that not to do, or in terms of interference, or in terms of worrying unnecessarily, or old methodologies?
Yeah.
Please,
give a message. Let the spouse be involved, not the in-laws or the mothers, because it binds a bondage between husband and wife and their family.
Beautiful point. And
but here, a point to be added. It's not the expectant girl's mother-in-law, or somebody who is interfering. It's the neighbors, it's the colleagues, and it's gone to the extent where
Sorry, I don't know what
with
Indian practice.
Yeah, pardon?
Sorry, I don't know what Indians are getting into.
No, it's happening. My friend had 10 times vomiting, but I haven't vomited once. Is my baby all right? And these are the things we come across, isn't it, Dr. Gayatri? Yeah. The whole lot of them share one lady's pregnancy topic.
It is a community affair.
Yeah, it's become a public affair. And I do ask them, don't you do your work in the office? This is what you're going to do. And discussing about each one's pregnancy. But at times they carry wrong messages, like one particular girl vomited 20 times and another one vomited just once and she hasn't vomited even once. Then it gives them a big query in their mind. And fetal edema, my friend's feet are all right, but why am I having edema? See, I always tell them no two girls are alike when it comes to pregnancy. For that matter, same girl in two different pregnancies, her behavior is going to be entirely different compared to the previous one.
True. Yeah.
Just to reiterate Dr. Jyotsna's point, I had a patient who once took an appointment from this side of town because her doctors who were looking after her had said she can't travel because she had a placenta previa. Now she said, my friend had placenta previa and you allowed her to travel, so give me a fitness certificate. When I go through her records, like I explained to you, my patient had a type 1 placenta which does not come in the way of her pregnancy. And this lady has a nice central placenta previa. I said, your doctors were right. You can't travel. She said, but you allowed my friend to travel. So you have to compare apples and apples, not apples and oranges.
Yes.
Well, I know a lot of people,
apples from different parts of the world also differ.